I guess I can take 5 minutes for Q&A, and then we go to the reception out there. So first of all, any question from the audience? I can probably ask some questions. So going to the ACGME talk, I think Victoria. Yeah, regarding the requirements that was mentioned, in terms of ACGME requirements, I think one of the problem is that some of the programs may not even have the devices. You mentioned that in your talk that like 3/4 of the program did have that, but still they don't have everything. They have some of the devices, but not the broad range, because it's very hard to, in fact, it's hard to do a lot of cosmetic procedure within the academic setting, because patients have not to come to the academic setting a lot of times. They rather go to private practice because of multiple reasons. So I don't know. Any thoughts about that? I mean, any thoughts of how you think we can solve that problems to make sure like most programs, all programs have at least the major devices that we are looking for?
Yeah, very true. That's a great point. It's very important that we balance, the feasibility of achieving this with making sure that residents are adequately trained. But the programs that would have had difficulty providing hands-on training may have had difficulty providing observational training as well, even if they perhaps they didn't have the proper adequate laser devices. We do have some thoughts about what we could do, potentially outsourcing, having residents rotate through other clinics in other areas that do have the proper devices. But yeah, that is a great point. And we do have to make sure that even as we make sure residents are adequately trained, that the programs are able to provide these requirements as well.
Perfect. Yeah, perfect. Thank you. Sorry, there are some questions here.
I mean, these acne scar patients, they come with so much knowledge which we are not even aware of because they read so much online, and half the times, or most of the time, they're not correct. And they also demand the laser type and the settings and all sorts of things. So I want to know, is there any study where the physician is unable to take care of the patient or not, they don't accept the patient or refuse to treat the patient? How many times, how many physicians, is there any study on that? Like, physicians refusing to treat these patients because it's impossible to meet their expectation.
I don't know if anybody has any comment on that, or, I mean, I can say, from my point of view, I don't think there is any studies on this because I don't think it's been done yet, but it'd be an interesting study to maybe look at. I'm not sure how would you do this study. But partly a lot of it will go to, I guess, multiple things will come out. Right now, the social media is so big that everybody has access to it. So that's part of the problem, I think, that you're describing. Obviously, internet is very big, and I think it's going to continue with the evolution of AI, the augmented intelligence and ChatGPT. So all you have to do is put in the ChatGPT, how do I treat acne scar? It's going to come up with a whole treatment protocol for you. This is how you treat it, maybe even come up with the treatment settings and all of those in the future. That may happen. Probably a lot of it may happen. So I think it's just the way things are moving, but I'm not sure if there's any studies to try to say, what the physician should do in that.
I was just curious if this is such a common problem, at least in my practice.
Right. Yes, go ahead.
All right, so great session for the lymphedema case, Helena. Was the CO2 fully ablative or fractional ablative? And the second question, did you encounter any problem with the healing process? Because those patients tend to have kind of like difficult healing for their wound generally. How did you feel about that?
So it was microablative, and as far as I know, my mentor, Dr. Bishkovsky's here, and he treated the patient. He can speak to the adverse events.
Sure. No, it's a great question. It was all fractionally ablative. We treated this patient multiple times. She didn't have any problems with wound healing, scarring. She had a little temporary PIH that resolved, and since then we've treated her with a number of other fractionally ablative devices without any problems.
Great idea.
It's actually a great question. Why I have you up on the podium is, in the past, there was a very controversial thing to treat any kind of a connective tissue disease, because of maybe due to photosensitivity and other things with lasers and light. But I think that has proven to be not correct, and right now we're even treating some of the lupus patients and DLE patients with lasers and lights. But I thought that was quite interesting, the question I was asked in terms of, lasers in general and, whether it's safe, to use in these type of patients.
We're working on all these as kind of a one-off, right? There's no guidelines, there's no data. We started treating this patient mostly from a microstomia standpoint. She had a lot of problems with range of motion, opening her mouth, able to chew, swallow, these types of things, and it was just a slow evolution. But we're looking to see where else we can go with it.
Perfect. Thank you. Yes, go ahead.
Just a quick question for the cutaneous siderosis case. What was your end point? Was it similar to that of a tattoo, or you get that epidermal whitening, or was it different?
Yeah, that was exactly the endpoint, was epidermal whitening. So we're trying a couple other lasers in a new patient we have with the same condition, and for our 1064 lasers, our endpoint's a little bit different, but for the 532s, our endpoint was epidermal whitening.
Thank you.
Yeah, thanks.
That's a great question. Yeah. And I guess one question for Dr. Kamarani regarding the gender-affirming procedures in dermatology residency. So I guess plastic surgeons probably are doing most of these procedures, right? So do you know much about their curriculum, or have you looked into that, like in terms of plastic surgery, curriculum? Do they have to study it? Because again, most of it is done by them.
Yeah, so plastic surgeons do a lot of the really invasive procedure like top
Right.
surgery and bottom surgery, and they don't have any ACGME requirements either.
Interesting, huh? Okay. Yes.
Just a question about the iron again. Just wondering if you have treated residual staining from bruising, like that we'll see on elderly patients on their arms or whatever.
Yeah, that's another great question regarding bruising. So we have tried using a pulse dye laser, 595 nanometers, for that bruising that we see in elderly patients, but to be honest, it doesn't work super well. The 532 we haven't really used for that indication, but we have tried the 595, hasn't worked very well, so we don't really offer it as much.
It's a really good question, but I mean, as
And
you...
not the bruising so much, but that residual kind of orangey brown, you know what I mean?
Hemosiderin, I think.
Yeah,
Got it.
hemosiderin.
Yeah. No, that's a great question. Maybe we can go back and try that again. But,
Yeah, I think it's, regarding the bruising itself, as many studies have shown that you can, after fillers and others, you get the bruising, you can use a pulse dye laser to treat the bruising. But I think I would be very cautious to treat those really fragile, super elastotic skin of those elderly patients with lasers, honestly. Yeah, so. Any other questions? Just a quick thing, in terms of the guidelines, I know Dr. Alam is very, very big in guidelines. He's actually one of the leaders in the field. So maybe you can tell us a little bit in terms of, you mentioned in terms of the process, but how do you choose, like, what to study and what grade or no, what device to use in terms of the guidelines in general?
Yeah, that's a great question. So I guess that's kind of what we did in our needs assessment by speaking with the experts that we kind of discussed potential options for where to start with guidelines. And we kind of just found throughout the process that establishing a guideline for the safe use of lasers, since that lasers are operated by many different types of clinicians, would be a great starting point for ASLMS. And then laser hair removal and tattoo are really common procedures, and so those would also be very helpful to establish guidelines on first. But it was difficult, and we have a long list, and I think once we get these three going, we can eventually continue making more guidelines related to lasers.
Very good, thank you. And Dr. Ishii, just a quick question. Pulse dye laser has been used for KP2, so how do you compare it to IPL?
Sorry. So when I was actually initially writing the protocol for that, I specifically chose IPL because it can just target multiple different components of the KP. One is the erythema, one is the actual texture and the hair removal, and then the other, of course, is any PIH that's left over. And I just find that,
Right.
well, also the nice thing is it's a larger crystal, and when you're treating kind of larger areas, the IPL crystal, it's just a little bit more efficient in our busy clinic. So that's initially the reason why I chose it. When they did pulse dye laser, it was very it works well with the erythema. It takes a lot longer. It's a lot more painful for the patient. And, you know, when I was doing my literature search, it turns out that purpuric settings work a little bit better, which patients obviously don't like. So, you know, that's kind of the reason why I ended up going the IPL route.
Got it. Makes sense. All right. Well, thank you so much, everyone. Great job. Don't forget, again, there is a reception that's going on upstairs, a networking reception. Thank you for everybody for staying this late, too. Great job.